We are going to limit that testing to those that are extremely ill, to those coming from nursing homes, for example, perhaps from the Mission, and those facilities that make a big impact on our community. We have to be very careful in how we use it because we don't know if we're going to get more than the 200 we already have. But the future is bright in terms of ability to expand the testing. I want to thank the State Health Department for working diligently with us to provide us with more testing.
The next question we have. Models are predicting this virus to peak in Wyoming at the beginning of May. Can you talk to us about your thoughts on that model and how long we can expect this to last here in our community?
It's a good question. It's the great unknown. The majority of the models that I've looked at and my partners have looked at suggest that we may peak at the very end of April and the first week of May. But we're in a rural area, and we really don't know what this virus is going to do exactly in areas like Natrona County and Wyoming in general. That peak may be smaller than expected, larger than expected, or may be more prolonged, or may not occur until later in May. But one thing that's very clear is that this virus is not going to just magically disappear in the next few weeks. It's going to hang around at a low level potentially for a long time. As we get more testing, we'll have a better idea of what is in the community and what to expect for the summer and the fall. But we're really not sure yet, and anybody that says they can predict that, they can't. And I want to make that clear that we'll get there, but we're not sure yet. Count on the end of the month for the moment at least.
Dr. Dow, we had an audio technical difficulty at the beginning when you were giving your comments on the masks and thanking a few organizations. Would you mind repeating that for us?
The entire part of it?
Yes, sir.
Okay. I would like to thank Mayor Friel, the county commissioners, the city manager, the EOC, Michelle Chulik at Wyoming Medical Center. I don't want to forget anybody. Anna Kender at the Public Health Department, the State Health Department, and all of the industry and seamstresses and everybody out there that's pitching in to try to keep this county healthy. It's extremely important. Now that I have a second chance, I'm going to talk about what I need from the community. We need masks. We need these cloth masks. We need them to be able to provide for everybody in the county. I'm calling for industry, anybody out there that has an opportunity and ability to make a mass production of these masks to help us. Then we can have distribution centers, people will have easy access to them, and they can wear them throughout the community. Remember, the CDC has said they would like everybody masking when they're out in public. And we'll talk more about masks in a little bit. But if anybody out there, any industry in our county can step up to the plate and make a lot of these, it'd be incredibly appreciated.
Thank you, sir. There are still people in the community saying this is no worse than the seasonal influenza or other illnesses we often see this time of year. How is this different from influenza, and why should people be taking it seriously?
Well, you can look at the national statistics and see, I think 22,000 people have died already. This is different than the seasonal flu. We have zero protection against this virus. And the death rate with this virus is much higher than the seasonal flu. Right now, that death rate's running 2.5% to 3%. A regular flu is much, much less than that. So one has to take this seriously. It's easy to think it's not that big a deal when it hasn't destroyed your community, but look at what's happening in Detroit, Chicago, New York, Boston. It's like a war zone, so don't get fooled by this.
The Wyoming Department of Health reported yesterday that approximately 42% of the statewide confirmed cases have recovered. Should people be seeing this as a sign of hope? And what does this mean that almost half of the cases have recovered?
It's great, but a great number of our cases have occurred in younger, healthy people in this state so far, excepting what happened in Fremont County when it hit the nursing facilities out there. And so it's a little misleading, but remember, I just said that only around 3% of people are actually dying from this. So the rest are going to recover. I think people get great medical care in this state, and that will help keep that number as low as possible. But somebody who's 30 that gets this should recover. So I look at it as what we would expect, although I will again compliment the care that goes on.
2 weeks ago, we were seeing several new positives a day. In the last week, we have seen on average 1 new positive a day. Is this a sign that we can let up on some of the social distancing guidelines?
No. In fact, I think it's falsely low. And I think it's probably setting us up for misunderstanding the data. I don't think it means anything. We're going to continue to look at trends, but if Wyoming follows every other area where there has been virus, we expect this to turn around and go up again. So we have not flattened any curve at all. But remember, we don't know exactly what that curve is going to be here in Wyoming, and we have to assume it's going to get a lot worse because we want to protect you. And we don't want to be lackadaisical about our approach and then have a lot of people die because we didn't do it the right way that's being recommended across the country.
What are the antibody tests people are talking about? Do we have the test in Natrona County, and how would someone go about getting one?
Okay, this is going to be a little more complicated answer, but I think we have time to do this. The test that we've talked about up until now actually detects a piece of the virus itself. It's RNA, it's genetics, and it shows that it's in your body. The antibody test is a protein that is detected. Your body's immune system is making this protein, recognizing this virus as new, and trying to protect you. When it first makes the protein, it's called an IgM, and the only reason I say that is you can read it in the newspaper. And then after a while, it changes to IgG. So if you run this antibody test in somebody that has been recently infected, their IgM, which is the early one, will be positive, and the IgG later will be positive. And that's how you tell how many people in your community have ever been infected by this virus. However, that really isn't a test that you're going to use to diagnose somebody with the virus when they're sick. We're going to use the other test. We want to know if the virus is in you. This antibody test is more giving us an idea of what is out there and how many people have it and have no symptoms, because that's one of our biggest concerns out there, is that people are carrying it and shedding it and passing it, and they're not sick. So this antibody test, another example would be this antibody test is being run in Major League Baseball players and the people working in Major League Baseball. 10,000 people getting tested to see how many have never been sick and still been infected with the virus. This test, there are 70 versions of this test, many not approved yet. And the problem is some of the tests are ending up not looking so good. So we are going back to the drawing board on some of those. Many have not been improved or approved yet, and so we're still not sure how we're going to use this in Wyoming.
How many people have been hospitalized for COVID-19 in Natrona County, and what kind of treatments have they received?
Well, let's give you an idea. Right now, we have 5 patients in the intensive care unit at Wyoming Medical Center that are infected with COVID-19. 5. 2 of them were transferred in. The others are homegrown. We have also had multiple patients in the hospital infected but not sick enough to go to the intensive care unit. We are testing very diligently, and we expect those numbers, of course, to go up. We have a huge surge plan coordinated between Wyoming Medical Center and the county and the state, that if we hit a giant explosion of cases, that we can handle it. And I'm very confident we can. We have the ability to probably ventilate 30 or more patients, maybe even 40, at Wyoming Medical Center. So we're ready to go if it happens. But right now, this gives us a chance to really practice all our infection control techniques, get everybody on page in case it really explodes here.
Different models predicted that there would be no deaths in Wyoming until the end of April as a result of COVID-19. Yet, we have already seen 2, and it's mid-April. Does this mean that the curve was not slowed like we wanted?
Well, the curve hasn't been slowed at all. We don't know where that curve is, I said earlier. I expect deaths. I mean, we have an aging population in Wyoming. We have a lot of people with COPD and heart disease and kidney disease, and those are the people that are at the highest risk of dying. I expect those deaths. I expect there to be a significantly greater number as we go along, and that doesn't surprise me at all.
You've begun stressing the importance of everyone wearing a mask. With your background as an infectious disease physician, can you talk about why this is important and where exactly people should be wearing the masks?
Well, as I mentioned earlier, we want more masks so that when I say this to everyone across the county and the region, you have an ability to do this. YouTube videos, CDC website, you can learn how to make your own mask. It's really easy to do. So eventually there's going to be no excuse for not having one. How would I like this county to approach this? The old an ounce of prevention. We've got to look out for each other. We've got to be careful about our patients that have chronic medical illness, our elderly, our grandmothers, our grandfathers, our parents, the people that could get very ill or die from this. I'm recommending, and my partners, Dr. Ganem, Dr. Elbogan, are recommending that everyone wear a mask when they're out in public. Not when you're exercising and jogging and taking your dog on a walk, but otherwise wear one. Wear one when you go to the grocery store. Wear one when you go shopping elsewhere. Wear one when you go anywhere in town. Do that for respect of everybody involved. I'm very disappointed in what I'm seeing out in our county thus far. I went to a local grocery store. Less than half the employees were wearing a mask, and 1 out of 4 people that were buying groceries were wearing a mask. That's not acceptable for our community. I went to the local post office. There were 3 employees, none were wearing masks. So that doesn't send the message that we want to send. Everybody involved in this COVID-19 pandemic and people trying to take care of you want you to do your part. I strongly urge you to do this for everybody's good, and we will keep you informed. As we get more and more masks available, we can let you know where you can pick them up. But take the time to make some yourselves as well right now. I can't stress this enough, and I want to stress the social distancing. We're seeing more and more people not paying attention to this, and we have got to do this. Social distancing is one of the ways we will keep this virus more quiet in Wyoming than it would be otherwise. Please double down. Don't get lax. We're not out of the woods at all. We're not trying to be mean to you. We're just trying to keep you healthy.
If there's anything else you'd like to share, sir, you're welcome to do so now.
Again, just try to do what we're asking you to do so everybody does well with this. None of us like this. I miss my sports. I miss all the things that we could do. But if you do what we need you to do, I think we'll be successful here in Wyoming. And I really want to keep you informed, so we'll keep doing this from time to time and update you. I will let you know that you read about the CDC being here today, looking at our plans here in the county and helping us with WBI. I want to compliment WBI on doing a very good job of trying to contain a problem that is not their fault, but is very tricky. And we're getting CDC input today. We'll be making some adjustments if we need to, but we'll keep you informed about that as well. We need to support our local hospitals. We need to support them because they've had it really tough lately.
Thank you, sir.
Good afternoon. I'm Steve Friel, Mayor for the City of Casper, and I'm here to answer some questions that were not allowed to be asked last night at our work session, being it's closed to public comment. So I'm here to answer those questions now.
Thank you, Mayor. The first question comes from Max Cotton with Wyoming News Now. Max asks, what is the council looking at in terms of the proposed ordinance forcing people to quarantine? Also, he'd like you to address potential concerns about violating people's civil liberties.
So to answer Max's question, the ordinance that came in front of the city last night covered a whole gamut of things, and the only thing that we had decided to keep with that ordinance and table for further investigation was a portion of the ordinance that would take care of a issue that we have right now when it comes to people quarantining. And what I mean by that, in the situation that we have found ourselves in, we've had patients that have been released from WBI, and as soon as they left there are some that are able to go home on a plan and self-quarantine at home. But some of those patients are in fact homeless people that have nowhere to go. And so what we put in place is the Westwood facility, and it's being staffed by nurses that can take care of these individuals. Where we run into a problem is we could put an order on them to quarantine, but we can't enforce that order. And so the ordinance itself is put in strictly for the reason of, right now, if somebody in this situation, if a homeless person decided they did not want to stay, they can walk away. And if we do not know for a fact that they are not carrying the virus, and if they've been exposed and there's a potential that they still have that virus, we have no way of stopping them from entering back into the community. And as you can imagine, going back into the community, and if you're carrying this virus and you're using our transportation system and you're going to Walmart or the mall or whatever it might be, the chance of this spreading throughout the community becomes tremendous. So the whole purpose behind doing the ordinance itself is strictly for the protection of the community as far as health goes, to make sure that anybody that has that virus or potentially has a virus or has been exposed to it is quarantined and made to stay quarantined to a point that until we can see that they're clear of the virus and it's not a medical issue anymore. On the side of the question, as far as people's civil liberties and violating them, the last thing we want to do is violate anybody's rights. And that's why it was sent back. And this is something that staff is working on this week. The questions are going to be asked of the attorneys, and the attorneys are going to ask the Attorney General for the state of Wyoming. We're not going to make a decision and put something into place that is going to violate anybody's rights on either side, whether it's a person that potentially has a virus or if it's a citizen that is just going about their business. We're going to make sure the ordinance fits and it does what we need it to do without violating anybody's rights, but also making sure that we keep the community safe.
Thank you, Mayor. The next set of questions comes from Morgan with the Casper Star Tribune. Morgan asks, You mentioned at last night's meeting you've been seeing issues with people suspected of being infected with COVID-19 not appropriately self-quarantining. Can you please elaborate on the circumstances of those instances and how many of those instances you are aware of?
So at last night's meeting, the one that I alluded to one, and the circumstances around that was a healthcare worker who has a roommate that is also a healthcare worker. And the first roommate was positive. The second roommate tested on Friday because they obviously lived together, and that person was exposed. We can all say that because they lived together. The person that had not received the test back had attended not one but two different parties over the weekend, one being on Friday and one on Saturday. And then Monday morning finds out that they're in fact positive with COVID-19. What's more disturbing about this is since I have arrived here to answer questions, I have been shown that this video of this party was put out on Facebook. And during this video, the individuals at these parties that we're talking about are flat out thumbing their noses at the fact that this is not serious to them. Well, I guess the question I have today is how serious is it, because all of those individuals are now quarantined out of both of those parties. And the person that this all began off of is positive, so we have two positive people that come out of this, but now a bunch of individuals that got together over the weekend are now quarantined because of the fact they've been exposed to this virus. So that's the one instance that I gave last night.
Thank you, sir. Based on based on the conversation from last night's meeting, it seems how the city would enforce those quarantines is still up in the air. What mechanisms does the city have to enforce self-quarantine recommendations, or what mechanisms are being considered?
So again, the ordinance that we were looking at last night is the avenue that we are wanting to go down, and that is the avenue that staff is working on diligently to get done. I made no bones about it last night. The time has been of the essence on this, and it's not just this week, it's been the last couple weeks. These are issues that we've been dealing with that we don't have answers to. We have gone all the way to the top, and we still have areas that we don't have answers to, and that's what we're working on today, is to find what we can do, what mechanisms, if you will, that we can put in place so that we make sure that people that have been exposed are quarantined so that we don't have a spread of this. The only thing I can say beyond that is that we've been preaching this for the last how many weeks now, that you have got to take this serious. And for people that say it's not a serious thing, I would ask you to find out, ask the people that just attended a party and tell me how serious it is now. It is very serious that we take these orders as they are, self-quarantine when you can. If you're exposed or potentially been exposed, quarantine yourself until we can get to a point that we make sure that you are not a danger to yourself or anybody else in the community by spreading this virus.
Mayor, you're welcome to add anything additional at this point.
I really don't know what else I can add. The question was asked to me this morning by a friend that contacted me and asked me he said I seemed frustrated last night. I probably did, and I probably do today. What people need to understand is this is not, the last thing that I ever want to do is task any of our police officers to arrest people or do fines. That does nobody any good, and that's the last thing we're ever going to do. But what I do want to do is keep this public healthy, and I want to keep it safe. That's all we've tried to do all along, and we're trying to keep a balance between a healthy public or a healthy community and keeping this community afloat economically. So all I can do is sit here and plead with you that if you in fact think you've been exposed or you find yourself in that situation, do what's right. Quarantine, don't be around others. until you know that you're safe enough to go out in the public. And please, everything that Dr. Dow has been up here talking about today and the doctors have been talking about all along, follow the advice and follow the orders. The moment that this gets out into the community, and if it does get out there and it takes off, the complaints of people not being able to do things now, if we have sickness, we can only imagine how bad things can get. So please, just keep doing what you're doing. I'll tell you, every time I make a comment, it comes back to bite me, but I'll tell you 90% of the people out there, if not more than that, you're doing what needs to be done, and please continue to do that. To the people that aren't, in the Facebook video I saw today, hopefully they've changed the way that they think, and I certainly hope if there's others out there that feel the same way as they do, this changes your mind. That's about all I have to say today. Thank you.
This concludes today's Natrona County Emergency Operations Center COVID-19 Response News Brief. We thank you for joining us. You can rewatch this entire news brief on the City of Casper YouTube channel and Casper Natrona County Health Department Facebook page. Until we see you on Friday, please keep yourselves and your families healthy and safe.